Hello, gentlemen. If you're over 50, 60, or beyond, and you've noticed that your moments of intimacy feel different, specifically, if you experience the full sensation of pleasure, that moment of climax, but without the expected presence of seminal fluid, this message is absolutely essential for you. Maybe it happened just once and instantly triggered a knot of worry in your stomach. Or perhaps it's a recurring, silent issue you've been keeping entirely to yourself, carrying a quiet sense of shame or a slow-burning fear about what it might mean for your health. I'm Dr. Adewale Morgan, a urologist with over 12 years of experience focused exclusively on men's vital health at every stage of life. And today, I want to have a serious, yet profoundly supportive conversation with you, man to man, doctor to patient. First, and most importantly, I want you to understand something clearly. The change you're noticing in your body is not a sign that your masculinity has expired or that your intimate life is finished. Let me reframe this for you. It is not a failure. It is a detailed message your body is sending you, and that message simply needs to be decoded. Stay with me, because in the next few minutes, we're going to explore the surprising causes, the critical warning signs, and, most importantly, the clear, manageable solutions that modern medicine offers to restore your peace of mind, your confidence, and your overall well-being. I've sat across from thousands of men who walked into my office feeling defeated. Most of them walked out with a plan, and their heads held high again. That's what I want for you today. Before we dive into what happens when the fluid is absent, let me give you a quick, practical look at how this process should work normally. No textbook language, just clear understanding. Think of your body's reproductive system as a perfectly coordinated military operation. The testicles produce the troops, the sperm. The seminal vesicles contribute the bulk of the nourishing, rich fluid. The prostate adds its own protective secretion. This final combination is gathered and staged in the urethra. When climax hits, specific muscles contract in a powerful, rhythmic sequence to propel that fluid mixture forward and out. It is a rapid, highly coordinated event, the result of precise timing between nerves, glands, and muscles all operating in sync. Now here is a distinction that I consider critical for every man to understand. Climax and ejaculation are not the same thing. Climax is the neurological sensation of intense pleasure, governed by your brain and nervous system. Ejaculation is the physical act of expelling the fluid. For most of your life, they happen seamlessly as one unified event, but they are driven by entirely separate mechanisms. This is not a trivial point. This distinction is the foundation of everything we are about to discuss. Our focus today is on what is clinically referred to as dry ejaculation. This is the technical term for when a man reaches climax, experiences that characteristic wave of pleasure, but notices little to no fluid is released. Men in my clinic often describe it to me as an empty orgasm. That gap between what they expect and what they experience is what drives the worry. And I understand completely why it would. You've always associated a physical sign with that event, but here is what you need to hold on to. Your ability to feel pleasure remains intact, governed by your nerves and your brain. The change is in the mechanical delivery system, not in your capacity for intimacy or connection. This does not mean you've lost your virility. It means a specific, identifiable part of your body's internal plumbing has changed, and changes can be investigated, understood, and often corrected. Quick pause before we move forward. If you are finding this information valuable, I'd ask you to hit the like button. It signals to YouTube that this kind of serious, men's health content deserves a wider audience. Subscribe to our channel so you don't miss future conversations that are built specifically for men like you. And drop a comment below. Tell me where in the world you're watching from. This community of men showing up for their own health across different countries and cultures is something I'm genuinely proud of. Now let's break down the 3 most common causes of dry ejaculation. Because knowledge is the foundation of control. 1. The gatekeeper is too relaxed. Retrograde ejaculation, the single most common cause, is a condition called retrograde ejaculation. Here is the biology. Picture a small but powerful muscular valve, a gatekeeper, sitting at the neck of your bladder. During climax, this valve should clamp down firmly, ensuring the seminal fluid has only one direction to travel, forward and out. But if this valve is too relaxed, if the gatekeeper falls asleep on duty, the fluid follows the path of least resistance and flows backward into the bladder instead. You feel the complete sensation of climax because the neurological experience is fully intact. But since the fluid doesn't exit, it feels dry. Here is the practical clue I give men to look for. Notice whether your urine appears cloudier than usual in the moments right after intimacy. If it does, that is not cause for alarm. It is simply the misrouted fluid mixing with the urine. It confirms the diagnosis, and it tells us exactly what we are dealing with. What causes this valve to malfunction? Most commonly, certain surgeries on the prostate or bladder. These procedures are often medically necessary and genuinely successful at what they are designed to do, but they can alter the fine nerve control over that small muscle. Additionally, it is a known and documented side effect of specific medications used to treat high blood pressure or an enlarged prostate. The medication does its job on the blood vessels, but it also relaxes that valve in the process. I recall a man I treated, a composed, disciplined professional, who came into my office visibly shaken after an otherwise successful prostate procedure. Once I explained to him that his ability to feel pleasure was entirely unaffected, that this was a purely mechanical alteration, like a valve that was now set to open instead of close, and that we had concrete options to manage it, the tension in his body visibly released. That is the power of understanding. 2. The plumbing is blocked. Duct obstruction, the second major cause, is a physical blockage within the ducts that the seminal fluid must travel through. Here is the biology. The seminal vesicles and other contributing glands are producing fluid normally. Production is not the problem. But imagine the small ducts as delivery pipes running through a complex internal structure. If any section of those pipes becomes blocked, the fluid, though fully produced, cannot make its journey. Volume drops dramatically or disappears entirely, even though everything upstream is functioning as it should. What causes these blockages? Scarring is the most common culprit, specifically the kind left behind by past infections, such as severe or chronically untreated prostatitis. In some cases, small calcifications can form within the ducts, functioning like tiny stones that obstruct the passage. The symptoms can be subtle. Some men describe a new, mild discomfort in the pelvic region during climax. Others report that over a long period of time, the fluid had been gradually becoming thicker and less abundant, a slow shift they dismissed or simply didn't know how to interpret. Here is the excellent news I share with men who come to me with this diagnosis. Many of these obstructions can be cleared. Anti-inflammatory medications can resolve swelling and scarring in a number of cases. Where medication alone isn't sufficient, minimally invasive procedures can be used to restore normal flow. This is not a permanent sentence. It is a treatable mechanical problem. 3. The engine is running low. Hormonal factors, the third major area we must investigate, is hormonal, and specifically, the role of testosterone. Here is the biology. Testosterone is the primary fuel for the entire male reproductive system. As a urologist, I want to be precise about this. It does not merely regulate desire and sperm production. It is directly responsible for the optimal function of the prostate and seminal vesicles, the very glands that contribute the bulk of the ejaculatory fluid. When testosterone levels fall significantly below the normal range, the entire system begins to slow and underperform. The impact often unfolds progressively. A man may first notice a reduction in fluid volume, a change he dismisses or attributes simply to age. But over time, that hormonal deficiency begins to express itself more broadly. Decreased libido, less firm erections, a generally reduced intensity of climax. And beyond the reproductive system, the effects extend further. Persistent fatigue, mood changes, irritability, and a gradual loss of muscle mass and physical drive. I've had men sit across from my desk and describe feeling like a lesser version of themselves, without being able to articulate why. Low testosterone is frequently the answer. This condition has a clinical name, hypogonadism, and it is a treatable hormonal deficiency, not an inevitable consequence of aging that must simply be endured. A straightforward blood test can confirm the diagnosis. When it does, carefully managed hormone replacement therapy can often restore not only improved fluid production, but also energy levels, sexual desire, and a broader sense of vitality and well-being. I have seen men in their 60s and 70s transformed by this intervention, not into someone they were at 25, but into the strongest, most functional version of who they are right now. That is what we are aiming for. When to come see me without delay, while the majority of dry ejaculation cases trace back to these three manageable causes. I would be doing a disservice to you as your doctor if I did not address the exceptions clearly. If dry ejaculation appears suddenly and without a clear explanation, especially if it is accompanied by pain, blood in the urine or fluid, fever, or a loss of sensation in the genital region, do not wait. Do not take a monitoring approach. Come in for an urgent urological evaluation. Certain neurological conditions, including Parkinson's disease and long-standing uncontrolled diabetes, can disrupt both the nerve signals and the physical plumbing involved in ejaculation. In rare cases, specific urological cancers can be a contributing factor. These scenarios require prompt investigation. The presence of accompanying symptoms is your signal that time matters. The emotional dimension, which cannot be ignored beyond the clinical. And as a doctor who has had thousands of deeply personal conversations about men's health, I must speak to the emotional weight of this experience. Many men carry a deeply ingrained equation in their minds. Fluid equals performance. Fluid equals virility. When that fluid disappears, the feelings that rush in to fill that void are real and significant. Inadequacy, anxiety, frustration. A quiet withdrawal from intimacy driven by the fear of being judged or feeling like less of a man. I've seen this pattern cause more damage to men's relationships and self-image than the physical condition itself. The most important thing I can tell you is this. What you are experiencing is a physiological change, not a personal failure, not a verdict on your worth as a man, not the end of your intimate life. Your ability to feel pleasure, to have erections, to connect deeply with your partner, does not hinge exclusively on the presence of seminal fluid. Your intimate life can and absolutely should continue to be a source of joy, connection, and meaning. Understanding the mechanism behind what is happening is the most powerful tool available to you. It replaces fear with clarity. It replaces shame with agency. And it opens the door to real, workable solutions. Your action plan, taking back control, let me leave you with a clear, structured path forward. First, don't ignore it. Investigate it. A sudden or progressive onset of dry ejaculation warrants a dedicated appointment with a urologist. A focused medical history, a targeted physical examination, and typically a blood or urine test are all that is needed to arrive at a clear, confident diagnosis. You don't need to walk in with answers. You just need to walk in. Second, get your underlying conditions under control. Diabetes, high blood pressure, and elevated cholesterol, when poorly managed, directly impair the vascular and neurological systems that govern everything we've discussed today. Managing these conditions is not optional if you want to protect and restore your intimate health. It is foundational. Third, and I say this with the full authority of someone who has watched silence cost men years of unnecessary suffering. Break the silence. Talk to your doctor. Talk to your partner. The act of speaking what you have been carrying alone is itself therapeutic. It removes shame from the equation. It creates space for solutions and professional support, whether that's a medication adjustment, a minimally invasive procedure, or hormone management, is your most powerful tool for restoring confidence and moving forward. In closing, gentlemen, the absence of ejaculatory fluid is not the closing chapter of your intimate life. It is not a final verdict on your masculinity. It is a signal from your body, one that deserves to be heard, respected, and investigated with the partnership of a qualified professional. Whether the cause is mechanical, obstructive, or hormonal, understanding that cause is the first step back to peace of mind. I have watched countless men walk out of my office with a diagnosis, a plan, and a renewed sense of control over their own bodies and lives. That transformation is real, and it is available to you. Your vitality is not measured in milliliters of fluid. It is measured in your health, your energy, your relationships, and your willingness to show up for yourself. Don't allow doubt or shame to stand between you and the answers you deserve. Act, seek the conversation. Come in for the evaluation, because acting in time can change everything.